Our final speaker is Senator Pia Cayetano from the Philippines. We've heard about innovative advocacy at the grassroots and the global level. Now we're going to have the opportunity to hear about policy change at the national level. Senator Cayetano campaigned in the face of adversity to ensure the passage of Philippines' recent reproductive health bill. We're excited to hear your story.
Thank you. Good afternoon. I'm going to talk about the struggles and the strategies that we use to pass the reproductive health bill. Let me start by saying that when I took on the challenge, I actually wasn't 100% sure that we would make it, so it was equally as stressful and full of surprises along the way. So let me get started. Just a quick outline of my presentation, the need for the reproductive health law, what the journey was like, and the strategies that we utilized. Quick facts, in the Philippines, 15 mothers die every day, and this fact was highly questioned almost daily. Our maternal mortality rate increased from 162 to 221 per 100,000 live births. Why is there a need for the reproductive health law? The real reason is to institutionalize the right and the access to reproductive health. As I was defending the bill in Congress, we already passed the budget that would support reproductive health, but that was only because we had a supportive president that was just elected that year. So in the last 5 Congresses and the last 4 presidents, we did not have a consistent reproductive health program. So it was my job to ensure that what the president wanted to do now, what we had wanted to do, would stand the test of time. And it took 14 years, and as I said, 5 Congresses. What happened during the time that the past president did not have a reproductive health policy, basically because she was a Catholic and was adhering to the Catholic doctrine, is that local governments came up with their own policies and passed local ordinances. And these ordinances included banning and discouraging the use of contraceptives, requiring pharmacies to ask for a prescription for the use of condoms, and making it embarrassing because they would require the pharmacies to keep a registry and a log of every buyer's purchase. This actually happened in my own district. Thankfully, there were so many empowered, mostly women, who rallied against it, but this is the kind of things that happen when you don't have a law. Thus, the journey of the reproductive health law. That's me, and that is my struggle. I did a lot of running and triathlon to cope with the stress. Our obstacles. First of all, the Philippines is a predominantly Catholic country, and the Catholic hierarchy strongly opposed it from the start and continues to do so today. Surveys show that Filipinos, mostly Catholics, are fully supportive of reproductive health, but it is the hierarchy that opposes it, and you will see the picture of the church. When we had our last election, they listed the names of the legislators who voted for reproductive health, including my brother. His name is there, and they're called Team Death. And in the homilies, my name was mentioned regularly in the list of people going to hell. Thankfully, I stopped going to Catholic church and did not have to hear it myself, but my friends would tell me about it. Thankfully, my children did not have to hear it because we went to a different church. But that is really sad, actually. Other obstacles. The Philippines is still male-dominated, and so is Congress, like many countries. We have, in the lower house, 21% only are women, and in the Senate, there are 24 members, and only 3 of us are women. And this is where it's very interesting. I want to share with you some of the anti-woman statements that I had to deal with on a daily basis. I am anti-RH because what surprises me, and these are men saying this, what surprises me is in the rural areas, without the assistance of doctors, women give birth. Hardly anyone would die. I do not know why they die in hospitals now. And the same person said, more men die going out to sea or into the fields to earn a living than women dying because of giving birth to a child. So I stand there patiently because I'm a marathoner and I know that the end is near. Another statement, there are no names, there are no faces to 11 maternal deaths a day. So I was asked to produce these names, these women dying, otherwise I would not get the support. I produced names, I produced birth certificates, still no support. So that's just how it is when you're defending reproductive health. The term safe and satisfying sex, this comes from ICPD, and this was highly debated and was in the headlines of our papers the following day. The men in the Senate said this is not necessary because it does not sound nice. We shouldn't put those things in a law. And another male stood up and said, sex is always safe and satisfying. Why do we need to say that? So I stood there and did my yoga. So my personal game plan. Well, as a lawyer, I decided that this would be like going through another bar exam, and I had nothing else planned except to meticulously study the bill and study it over and over again till I was blue in the face and dreamt about it and thought about it in every waking and wherever I was. And my staff was very prepared as well. People seriously always ask me how could I, this was live televised many days, especially during the safe and satisfying types of debates, and they would ask me how I stood there patiently and still smiled. And I said, well, I'm an endurance athlete. I can run for 3 hours. I can bike for 6 hours. What's another 5 hours every day of trying to save a life? So I stood there for many days, for almost 3 years. And as a mother, I actually made a conscious decision to share my story. I lost a child, my third child, and eventually adopted a baby. So I shared that. So when I had to deal with 3 male senators who said that they're against contraceptives because their wives lost a child, then I shared my story. I lost a child too. And many women lose children not having been on contraceptives or even before contraceptives were invented. One senator said his wife lost a child because she used Diane, and it turned out that Diane had not even been invented when his wife lost the child. So I shared my story, even though it was not always pleasant, but it was something that I felt needed to be told. And as a women's advocate, I shared other women's stories and did not hesitate to express my emotions about how difficult it is for them, for me to be a woman many times, especially to sit through these kind of debates. And in the end, I actually made statements. I made a very strong statement, and I said being anti-RH is being anti-woman. Strategies to victory. So we had an overarching framework: alignment of political forces, community-based engagement, media as a catalyzing mechanism, and a deeper understanding of the separation of church and state. Alignment of political forces. This is my ally, Senator Miriam. She's actually going to be going to the International Criminal Court, and I will be losing a very staunch partner and ally. But in the beginning, it was just the two of us. It took a while for the last female member of Congress to declare that she was pro-RH. So towards the end, we had a full force women, 3 women who were pro-RH in the Senate. And as I will show you now, it required that our president was very supportive. He never wavered in his support, and he actually was threatened to be excommunicated at some point in the beginning. And then they stopped with those threats because he did not budge. And then we did have very strong proponents in the lower house who had been fighting for this measure for many years. And civil society. I cannot say enough about our civil society. Many of them are here. They carry the torch for decades on reproductive health. They were on the streets. They were rallying in Congress, both the lower. They would like divide themselves and be in the lower house in the morning and go to the Senate in the afternoon, and that's like 3 hours away, and with Manila traffic. And they were out there at the same time rallying and then attending to the needs of the women in the community. So this is the kind of women we have. For the first time, and that's why I said the political forces were aligned, academe, students, we kind of got our act together. Academe started making statements, having their own press cons, giving papers on the need for reproductive health. Health professionals joined in, and I actually had by my side on the 2 lower pictures, the 2 former secretaries of health who provided not just data, but strong moral persuasion when, imagine them being there almost every day, seriously, and also providing me with much needed moral support. Media. I use both traditional and social media. So on traditional media, I actually did the circuit of TV shows on news and even on noontime, talk shows that were on the lighter side, but help people understand. There was so much misinformation being spread, like really like blatant lies and twisting the truth of what the intention of the bill was. So I had to really go out of my way to keep on talking about it and explaining what it was all about. Of course, the news had stronger interest, and thankfully a lot of the columnists started to becoming more understanding of what the issues were. There were still those who did not believe in it, but generally there was a lot of coverage on the reproductive health progress. And then social media, what a perfect time for another venue to talk about reproductive health. This is actually my blog. It's called My Daily Race. I blogged about reproductive health, 10 facts about reproductive health, and then I would tweet it whenever people would ask me, and I would get asked like sometimes 30 times a day, and I would just refer them to my blog. I actually also have an official website, an official Facebook, and a personal Facebook, but I am most active on Twitter, and it has been extremely exciting for me to use that as a medium. And then the deeper understanding that separation of church and state is a constitutional mandate, is required. Up to this day, I believe that it will be a challenge because many legislators at the end of the voting not quoted, but prayed the rosary, prayed the Our Father, the Holy, the Apostles' Creed and all the other prayers, and then say, I am anti-RH. So there's a very, a lack of understanding of the need to separate your personal and moral views from what you need to do as a legislator to represent the needs of the entire nation. And then let me come to the very end. They said that the bill would never become law. They said that I would never get enough signatures for my committee report. They said that it would never be calendared on the Senate floor, that I would never be able to answer all the questions during interpellations, that the period of interpellation would never end. I thought that at some point. And when it did, they said I would never recognize the RH bill because they would amend it so much that it would not look like a reproductive health bill. I defended it, and it still looks like a reproductive health bill. It is a law now. And they said I would never get the votes. In the end, I got this all done, and I had 2 days left to get the bicameral conference done. No, sorry, I had 2 days left before one more senator had to make their amendments. And he did not do it on the day that we had initially agreed upon, but in the lower house on that day, December 12, I went there and I witnessed a momentous moment. It had been pending for 14 years, so you know that feeling. I wasn't a senator then yet. I joke I wasn't born yet, but I wasn't a senator yet when it started with Congressman Lagman. And we didn't even know what the count was, and we only knew the final count, 113 to 104, less than 10 votes, to pass this in the lower house on December 12. So then the burden was me all weekend, and you can imagine it's the worst weekend of my life. I was counting votes every day, which changed every day. Bishops and everybody else was calling senators to change their votes. And finally, on December 17, we called it to a vote, and we won 13-8. And those are the women who were there daily. That is my co-sponsor, Senator Miriam, and that's actually my staff who did daily work on this. So that happened on December 17, and I thought on December 18 we would be able to reconcile the two differing versions of the House and the Senate, but then it stalled again. Obstacles. I was not allowed to choose my bicameral conference members. They kept changing it. And I was like, yeah, why did I expect this to be easy? This is the RH bill. This is women's rights. It should be hard every step of the way. So I was left with 1 day before Christmas, specifically 5 hours to get it done. And we did get it done on the very last hour. That's my panel of men. The majority were on my side. So we got it passed just before Christmas, and we now have a reproductive health law.